So wishing all of you good day, good time, loving and kindness, metta. All of you completing, congratulations, all the best. All of you completing your fourth week of quarantine. Um, so all of you were staying home for 4 weeks. It's not easy. It's difficult. Experiencing a lot of anxieties, fears, stress, some feeling of grieving, trauma. So I'm wishing all of you to be strong and success. And we all living in a place without many support. I would try my best to talk and provide support. It's minus 13 outside, but I thought I'm gonna come in my sunroom and little spend time with all of you and talks about what we could do possibly during this outbreak. The anxiety is still there, the stress is still there. We all suffering anxiety and stress. So, but there's thing we could still do and try. If you have any question during this little video, question me, ask me. Good morning, Tracy. Thank you for always your support with our organization, our work. So the outbreak is looks like getting bigger, and the numbers are getting bigger. The numbers are almost close to 35,000 right now. Um, Luckily, I don't know the lucky is the right word, but for some reason, up north is still doing well. I wish and hope everything would be settled down very soon. Stress during this infection time, this outbreak pandemic period, brings a lot of fear and worry about our health, and even lots of worry about our loved ones, and people on duties, on people on outside work. It brings a lot of fear and anxiety. It changed our eating pattern, our sleeping pattern. We experience a lot of difficulty of sleeping, right? um, um, Even we, let's say someone is living with diabetic or blood pressure, or some physical condition, this type of outbreak, this type of pandemic outbreaks always worst what we dealing, because our level of anxiety is very high. um, and it's also triggering our personal issues with substance, drugs, alcohol, any other behaviors with video games, TV watching time, screen times. Like, it changed a lot of things in our life. Everyone react stressful situation differently. It's always based on our background. What I mean by the background is not education. It's based on our health, and our resolved or unresolved psychological issues, problems, many different things. So that's how people react to stressful pandemic situation. For example, all senior populations with many challenges, they respond to this type of stress very differently. And children and teenagers, they respond very uncertainly. They respond very different and uncertainly. And people living with front lines, people working in front line, people exposed to a lot of risk, they react very much differently than everyone. So it's very important to taking care of yourself and your friend and your family members during especially the coping level of this pandemic period. So let's talk about some way of coping, because a lot of people sending me email and asking me questions about how we could do coping, what we do possibly to improve our coping skills, and coping mechanisms. It's important to take a break with watching, reading, listening, and living time with to expose stories. Um, um, so you have to make time to unwind. Maybe come out with some some thing that you really enjoy. Come out with some insights that you really enjoy, that you don't have time last many years to try in your life. And it's important to physical health, right? Like I discussed many times, life balance is all about biological, psychological, spiritual, and social. Okay, so this is the excellent time you to come out with a list of your physical health, uh, balancing your physical health, your task, and how you balancing your psychological health, and what you doing for your social improvement. Then also and also spiritual life. Spirituality is not all about praying or going to church or following a religion. Spirituality is finding your inside by engaging with yourself. We will discuss one day about what spirituality and how would you do possibly to find your own spiritual values. And like I said before, it's always important to connect with your friends and close people long distantly over the Skype, web timing, Viber, emo, WhatsApp, or telephone or FaceTiming, and discuss and share some of the life experience you had with them, or with generally that you had no time last many years to share with them. This is the good time to connect with family members and other people who had been missing your life. Um, 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 Very important time to find that relationship and rebuild the relationship. For example, if your mom and your children are apprehended and live in some other places, this is the great time to have many time with them over FaceTiming or Skype, and sit and talk to them about life and many things, because everyone have plenty of time during this outbreak. Um, there's many factors help to reduce your stress, and please do understand and believe stress is a normal thing. It is a reaction to situations. If it is starting reacting abnormally and challengeably, then stress is becoming more challengeable. So you need to accept your stress. Like we discussed with our mindfulness program, you need to start accept your stress as the way it is, and without judgmenting your stress. Um, Healthcare providers are all over the places. They're providing services different places. They focus with different subjects, so contact them if you need. Especially for the parents, as you know, maybe you already notice, your children may react to the pandemic outbreak very differently. There seems like the adult around them, they always observe how the adult react. Sometimes they change their reaction based on adults, or sometimes they don't change the reaction based on adult. When parents and caregiver deal with the pandemic COVID-19 effect, and they more manage their calm and anxiety and fear, children always try to follow them, because their insight, their subconscious is not fully helping them to understand what this is about, what factors, what challenges behind the pandemic outbreak. They provide you some insight, some hints. So you really need to read your children. It's important to spend time with them. Uh, Not all the teenagers and children respond to stress in the same way. Maybe you see sometimes they are crying for no reason. Maybe you see their irritations with their behaviors. They might react, overreact, or maybe you see a lot of unrecognizable behavior, so that you don't really know why they are doing the way they are doing. Um, for example, child living with ADHD, attention deficiency, hyperactive deficiency, you see some of them are very calming because the anxiety, some of them are very hypering. So this hypering is not always the symptomized based on ADHD. Maybe they are hypering because they affected by the outbreak anxiety. So it's important you to read and understand their reactions. So you see they are trying to eat unhealthy, maybe they are refusing, rejecting schoolwork, homework, they're complaining about, mommy, daddy, my head is paining, my head is heavy, I feel headaches. So they might complain you about many things. Maybe your teenager exposed to drug and alcohol, maybe doing drug behind your back, because they cannot tolerate the anxiety and fear based and coming from pandemic outbreak. So many things you notice from your children. How could you help them basically before you accessing your therapist or your counselor or your school counselor? Talk to them about talk to basically them about the COVID-19 outbreak very openly by using public materials, TV programs, YouTubes. Help them to more normalize and familiarize with the outbreak knowledge. Answer their questions based on your knowledge or based on the resources you have. Reassure your child, teen that may be safe, especially affecting the level of anxiety coming from the outbreak. Um, uh, Limit your family exposed to the news coverage. I know the news is uncontrollable. Wherever you turn on this time, the news is TV news, TV programs are all over. But you need to make sure children are not watching the TV programs and news that they are not that they cannot tolerable. You know, the perceptional toleration is very realistic toleration with teenagers and children are different than adult. So you need to make sure what messages and news are appropriate to their inside, their subconscious, sorry, their conscious. So important to keep every routine regular so that they don't feel strange behavior around home, and be a role model always, because you don't have to expose your own fear with them. They are not ready to tolerate your own experience. Common reactions are a lot with everyone concerned about protecting themselves during the pandemic outbreak. The social isolations always bring a huge amount of anxiety, uncertainty, and many triggers. So you want to make sure that the always guilt and shame waving between adult, and also trauma and grief is very highly exposed at this time. Probably tomorrow I would like to talk about how we could manage our trauma and grief, especially during the pandemic outbreak. Um, so if you have any questions, you could please send me and ask me. I would like to have this discussion because few people question me that why don't I really discuss about outbreak, COVID pandemic outbreak? Why don't I really discuss anything after 1 week? Um, it looks like we all still have a lot of needs to talk about this topic, even we don't like to talk about it. Again, not talking about it, not thinking about it, not trying to do with it, it doesn't help resolving the anxiety and fear around generated and affected from COVID-19. All that rejective behaviors and feeling goes to your bottom of the iceberg. It will come out some more time. It makes you anxiety. So it's good to deal with the situation by using mindful path, mindful accept, by becoming not judgmental, accepting, and more mindful reactions. I had to speak a little bit fastly because it's cold outside. I thought I'm going to do this video outside. I hope all of you like to see things outside because all we living inside for the last 4 weeks. So all I can think about quite a bit this few things. I'm sure you already noticed many things I discuss about the anxiety and stress. People living 4-5 weeks with the quarantine procedure and coming out once in a while, they experience a lot of strange feeling, which I would like to discuss in another video. And especially the stressors and isolations and uncertainty bring it out many unresolved issues that you had been dealing your life or that you haven't been dealing your life. This is the good time you to find resources to deal with those unresolved issues, because issues are not resolving automatically, and we have a perception that's always time revolve, always time resolve issues. No, time won't resolve issues. Grief won't, trauma won't resolve by time. All it based on your biopsychosocial, spiritual, healthy lifestyle and what you do in interpersonal impact to change and make difference your issues. So I'm going to finish today, and I'm going to try tomorrow sometimes to talk to all of you, and enjoy your weekend. You have a wonderful day, and I'm wishing all of you loving and kindness, offering you loving and kindness. May you be safe from all the risk around the pandemic period. And thank you for joining with our Integrative Mindfulness Center official Facebook, and question me, ask me if you have anything to clarify, and stay safe. Bye for now. Metta.